Some medicines come from the kitchen, not the pharmacy. And after 60, one simple spice has gained attention among doctors not because it suppresses symptoms, but because it helps the body calm inflammation naturally. Inflammation is not the enemy. It's a normal immune response designed to protect and repair. The problem is that as we age, inflammation tends to stay switched on at a low level even when no threat is present. This quiet, persistent inflammation affects joints, blood vessels, digestion, and even brain health. You may notice it as stiffness that lingers, slower recovery, or a general sense that the body feels more reactive than it used to. These are not signs that the immune system is failing. They are signs that inflammatory signals are not being resolved efficiently. Doctors studying healthy aging focus less on blocking inflammation and more on guiding it. The goal is not to shut the immune system down, but to help it return to balance once its job is done. This is where certain kitchen spices come into the conversation. These spices don't act like painkillers, they work upstream, influencing how immune cells communicate and how long inflammatory signals remain active. One spice in particular has been widely studied for its role in supporting this balance. It contains natural compounds that interact with immune pathways involved in inflammation resolution. Instead of forcing inflammation down, it helps immune cells complete the inflammatory process properly. After 60, this distinction matters. Aggressively suppressing inflammation can interfere with healing and immune defense. Supporting resolution allows the body to protect itself while avoiding unnecessary damage. What's interesting is how gently this spice works. It doesn't act instantly, it works over time through regular exposure, helping reduce background inflammatory noise. You may notice this as less morning stiffness, improved joint comfort, or steadier energy levels. These changes reflect reduced inflammatory burden rather than pain masking. This spice also influences oxidative stress. Inflammation produces oxidative byproducts that damage tissues if they accumulate. Compounds in this spice help neutralize these byproducts, reducing wear on cells and blood vessels. Brain health is also affected. Chronic inflammation interferes with cognitive clarity and mood regulation. Supporting inflammation balance helps maintain clearer thinking and emotional steadiness. Doctors appreciate this spice because it integrates easily into daily life. There's no complex protocol, no aggressive dosing, just consistent, moderate use as part of meals. After 60, the body responds better to steady signals than to strong interventions. This spice provides a signal the immune system recognizes and responds to gradually. Another benefit is its interaction with digestion. Inflammation in the gut often drives inflammation elsewhere. This spice supports digestive comfort, which in turn helps calm immune signaling throughout the body. You may notice improved digestion or less bloating when using it regularly. This reflects better gut immune communication. It's important to understand that this spice does not replace medical care or eliminate inflammation entirely. Its role is supportive. It helps the body do what it's already designed to do, but more efficiently. Doctors who recommend it emphasize consistency over quantity. Small amounts used regularly are more effective than large amounts used occasionally. This approach aligns with how the immune system works after 60. It favors patterns, not extremes. Gentle, repeated signals guide immune behavior more effectively than sudden changes. As you continue watching, you'll learn which spice doctors rely on, how it supports inflammation control naturally, and how to use it safely and simply so your body stays comfortable, balanced, and resilient as you age. After 60, chronic low-grade inflammation becomes more common because inflammatory signals take longer to shut off, and this change happens quietly over time. Inflammation itself is not harmful. It is one of the body's most important protection and repair mechanisms. The issue is not that inflammation occurs, but that the body becomes less efficient at turning it off once its job is done. In younger years, inflammation follows a clear pattern. A signal appears, immune cells respond, the issue is resolved, and the system returns to baseline. After 60, that final step slows. Immune cells may remain partially activated even after the original trigger is gone. This creates a constant background level of inflammation that can persist for years without obvious symptoms. You may notice this as stiffness that never fully disappears, joints that feel off even on good days, or fatigue that doesn't match your activity level. These sensations are not random. They often reflect immune signals that are lingering longer than they should. Several age-related changes contribute to this. Immune cells become less responsive to shutdown signals. Hormonal rhythms that help resolve inflammation become less precise. The gut and nervous system, both of which influence immune behavior, become more sensitive to stress and disruption. As a result, inflammatory messages echo longer in the body. Instead of a short conversation, inflammation becomes background noise. This low-grade inflammation affects multiple systems at once. In joints, it accelerates wear and slows recovery. In blood vessels, it reduces flexibility and increases strain. In the brain, it interferes with signaling and contributes to mental fatigue and mood changes. What makes this process challenging is that it often goes unnoticed. There may be no sharp pain, no acute illness, no clear warning sign.
Yet over time, this constant inflammatory state places stress on tissues and speeds biological aging.
Doctors refer to this process as inflammaging, not as a diagnosis, but as a description of how aging and inflammation interact. The immune system remains active but less precise. After 60, the goal is not to eliminate inflammation, that would be harmful. Inflammation is necessary for healing and defense. The goal is to help the body resolve inflammation properly. This is why aggressive anti-inflammatory strategies are not always ideal. Completely blocking inflammation can interfere with healing, digestion, and immune defense. The body doesn't need silence, it needs closure. Supporting inflammation resolution means helping immune cells receive the signal that their job is finished. When that signal is clear, immune cells disengage, tissues recover, and balance returns. You may notice that when inflammation resolves properly, the body feels lighter. Movement is easier, recovery is quicker, energy feels steadier. These changes reflect immune efficiency, not suppression. After 60, inflammation also becomes more sensitive to lifestyle patterns. Sleep quality, stress levels, gut health, and nutrition all influence how long inflammatory signals last. Small disruptions can have a larger impact than they did earlier in life. This is why daily habits become so powerful. The immune system responds to patterns it sees repeatedly. Gentle, consistent signals that support resolution can gradually lower baseline inflammation. Doctors studying healthy aging focus on reducing inflammatory noise rather than chasing individual symptoms. When background inflammation decreases, many seemingly unrelated discomforts improve together. This approach also protects long-term health. Chronic inflammation is linked to cardiovascular strain, metabolic imbalance, and cognitive decline. Helping inflammation shut off properly reduces cumulative damage over time. It's important to understand that this process is gradual. Inflammation does not disappear overnight, and it does not need to. The body responds best to steady guidance, not sudden force. After 60, the immune system becomes less tolerant of extremes but more responsive to consistency. Supporting resolution day after day teaches immune cells how to complete their work efficiently. Recognizing that chronic inflammation is often a problem of delayed shutdown rather than excessive activation changes how we approach health. Instead of fighting the immune system, we work with it. By understanding why inflammatory signals linger longer after 60, we can choose strategies that restore balance gently. This creates an environment where the immune system can protect, repair, and then rest, supporting comfort, resilience, and long-term well-being as the body continues to age. Doctors prefer natural inflammation resolving compounds that guide immune balance rather than aggressively suppressing inflammation, especially after 60 because the immune system changes how it responds to forceful intervention. At this stage of life, the immune system is not broken, it is simply more sensitive, more reactive to stress, and slower to return to rest once activated. Traditional anti inflammatory approaches often focus on blocking signals. They attempt to silence inflammation as quickly as possible. While this can be helpful in acute situations, it is not always the best long-term strategy for aging bodies. Suppression stops the signal, but it does not teach the immune system how to finish the process properly. Doctors who focus on healthy aging look for a different approach. Instead of stopping inflammation mid-conversation, they aim to help immune cells complete the conversation and move on. This is what inflammation resolution means. It allows the immune system to respond when needed, then disengage smoothly after 60. Aggressive suppression can create unintended consequences. When inflammation is blocked too strongly, immune cells may fail to complete repair tasks. Tissue healing can slow, digestive balance can be disrupted, the immune system may rebound with increased sensitivity later on. Natural inflammation resolving compounds work differently. They do not silence immune activity, they help guide immune behavior. These compounds interact with pathways that signal completion rather than shutdown. They encourage immune cells to stand down once the job is done. Doctors appreciate this approach because it respects how the immune system is designed to function. The immune system is adaptive, it responds to guidance better than force, especially with age. You may notice the difference in how the body feels. Suppressive approaches often produce fast but temporary relief, followed by stiffness or fatigue returning. Resolution supporting approaches tend to work more gradually, but their effects feel more stable and lasting. Another reason doctors prefer natural compounds is safety over time. Aging bodies process substances differently. Strong interventions may accumulate or interact unpredictably. Gentle compounds that align with natural immune signaling are easier for the body to handle consistently. After 60, consistency matters more than intensity. Doctors often emphasize small daily actions rather than powerful short-term fixes. Natural compounds fit this philosophy because they work best when used regularly and moderately.
Inflammation also interacts closely with other systems, including the gut, the nervous system, and circulation. Aggressive suppression can disrupt these connections. Resolution focused compounds support balance across systems rather than isolating one pathway. You may notice improved digestion, steadier mood, or better sleep when inflammation is guided rather than suppressed. These changes reflect improved system coordination. Doctors also consider how inflammation affects long term resilience. Chronic suppression can weaken the immune system's ability to respond appropriately to real threats.
Resolution support preserves responsiveness while reducing unnecessary activation. This balance is especially important after 60 when recovery takes longer. The immune system must remain capable without being constantly overworked. Natural compounds found in certain foods and spices have been studied for their role in inflammation resolution. Doctors value these because they have a long history of dietary exposure. The body recognizes them as familiar signals rather than foreign agents. These compounds often act upstream, influencing how immune cells interpret stress signals. Instead of reacting strongly, immune cells respond proportionally and return to baseline more easily. You may notice fewer flare-ups, less lingering soreness, and smoother recovery when immune balance improves. These are signs that inflammation is resolving more efficiently. Doctors also appreciate that natural compounds encourage patient participation. Using food-based strategies empowers people to support their health daily without fear or dependency. After 60, feeling in control of health choices matters. Gentle, familiar approaches reduce anxiety and improve adherence. The preference for natural inflammation-resolving compounds reflects a broader shift in medicine toward supporting the body's innate intelligence. Rather than overriding systems, doctors aim to restore communication. This philosophy aligns with how aging bodies thrive. They respond best to clarity, rhythm, and gentle guidance. By choosing approaches that guide immune balance instead of suppressing it, doctors help reduce inflammation without compromising healing. This creates a stable internal environment where tissues recover, systems cooperate, and the immune system remains calm yet capable. After 60, this balance becomes one of the most important foundations for comfort, mobility, and long-term health. This spice works upstream by supporting immune communication and helping inflammation complete its natural cycle, which is why doctors pay close attention to how it influences signaling rather than how quickly it reduces symptoms. Inflammation is not meant to be permanent. It follows a sequence: activation, response, repair, and resolution. Problems arise when that final step is delayed or skipped. After 60, immune signaling becomes less coordinated. Immune cells still respond to triggers, but the signals that tell them to disengage become weaker or arrive too late. As a result, inflammation lingers even when no active threat remains. This spice contains natural compounds that interact with immune messengers involved in this resolution phase. Instead of blocking inflammatory signals outright, it helps restore the balance between signals that activate inflammation and those that turn it off. Doctors describe this as working upstream because it influences the decision-making process of immune cells. Rather than reacting aggressively, immune cells receive clearer instructions about timing, intensity, and duration of response. You may notice that this produces a different type of benefit. Relief is not sudden or dramatic. Instead, discomfort fades gradually. Stiffness lessens over days or weeks. Energy stabilizes. This reflects improved immune communication rather than symptom suppression. One of the reasons this upstream approach matters after 60 is because the immune system becomes less tolerant of confusion. Mixed signals lead to prolonged activation. Clear signals allow immune cells to complete their work efficiently. This spice also influences pathways involved in cellular stress. Inflammation creates oxidative stress, which further confuses immune signaling. By reducing oxidative interference, immune messages become easier to interpret. You may notice that recovery feels smoother when oxidative stress is lower. Muscles feel less heavy after activity. Joints feel less reactive. These changes reflect cleaner communication rather than reduced activity. Another important aspect is how this spice interacts with the gut. The gut is where immune communication is shaped. This spice supports digestive comfort and gut balance, which indirectly improves immune signaling throughout the body. After 60, gut-derived immune signals play a larger role in determining overall inflammation levels. Supporting gut communication reduces inflammatory noise at its source. Doctors also value that this spice does not force immune cells into inactivity. Suppressing inflammation completely can interfere with healing. This spice allows inflammation to occur when necessary, then helps guide it toward resolution. You may notice fewer flare-ups rather than complete absence of inflammation. This is healthy. It indicates that the immune system is responding appropriately and standing down afterward. Another benefit of upstream support is reduced dependency.
When immune signaling improves naturally, the body relies less on external interventions to maintain comfort. Doctors studying aging immunity emphasize that the immune system must remain adaptable. Strategies that rigidly block pathways reduce adaptability. Strategies that improve communication enhance it. This spice works gently, reinforcing existing resolution pathways rather than introducing new ones. The immune system recognizes these signals as familiar, making them easier to integrate. Consistency matters here. Upstream effects accumulate over time. Regular exposure reinforces signaling patterns, training immune cells to resolve inflammation more efficiently. After 60, the immune system responds more to repetition than intensity. Daily use supports gradual recalibration. You may notice that benefits extend beyond joints, circulation feels better, mental clarity improves. These changes reflect systemic improvements driven by reduced inflammatory noise.
Doctors appreciate this wide reaching effect because it indicates improved coordination across systems. When immune communication improves, other systems benefit automatically. This upstream approach also reduces the risk of rebound inflammation. When inflammation is suppressed abruptly, it often returns. When it is resolved naturally, it is less likely to reappear. After 60, stability becomes more valuable than speed. Gentle, sustained improvements protect long term function. By supporting immune communication rather than fighting inflammation directly, this spice helps restore the natural rhythm of immune response. Activation happens when needed, resolution follows without delay. This rhythm protects tissues, conserves energy, and reduces cumulative damage over time. It allows the immune system to do its job without overstaying its welcome. Understanding that this spice works upstream explains why doctors rely on it as part of a broader strategy. It doesn't act like a drug, it acts like guidance, helping the immune system complete its cycle smoothly and maintain balance as the body continues to age. Regular use helps reduce oxidative stress, protecting joints, blood vessels, and brain tissue over time. And this effect becomes increasingly important after 60 because the body's ability to neutralize oxidative damage naturally declines with age. Oxidative stress is closely tied to inflammation. When inflammation remains active, it produces reactive molecules that damage cells if they are not cleared efficiently. In younger years, the body's antioxidant systems are strong enough to manage this process. After 60, those systems still function, but they work more slowly and with less reserve. This means oxidative byproducts are more likely to accumulate, especially when inflammation lingers. You may not feel oxidative stress directly, but you see its effects. Joints feel stiffer after normal activity. Blood vessels lose flexibility. Mental clarity feels less sharp during periods of stress or fatigue. These changes often reflect oxidative wear rather than structural damage. This spice contains compounds that help neutralize oxidative byproducts before they can interfere with cell function. By reducing oxidative stress, it indirectly reduces the burden on immune cells, allowing them to resolve inflammation more effectively. Doctors value this mechanism because it protects tissues without shutting down immune activity. The immune system can still respond when needed, but the collateral damage from prolonged activation is reduced. Joints are especially sensitive to oxidative stress. Cartilage and connective tissue have limited blood supply, which slows repair. Oxidative damage accelerates wear in these tissues. Supporting antioxidant balance helps preserve joint comfort and mobility. You may notice that regular use leads to smoother movement and less lingering soreness. These improvements often appear gradually, reflecting reduced cumulative stress rather than immediate pain relief. Blood vessels also benefit from reduced oxidative stress. Oxidative damage stiffens vessel walls and disrupts signaling that controls dilation and contraction. Over time, this contributes to circulation issues and cardiovascular strain. By reducing oxidative stress, this spice helps maintain healthier vessel function. Improved circulation supports oxygen delivery and nutrient transport, benefiting every organ system. You may notice warmer hands and feet or steadier energy levels. These changes often reflect improved vascular responsiveness rather than changes in activity. The brain is another area where oxidative stress has a significant impact. Brain cells are highly sensitive to inflammatory and oxidative signals. Chronic oxidative stress interferes with communication between neurons, affecting memory, focus, and mood. Reducing oxidative stress supports clearer thinking and emotional stability. This does not happen overnight, but consistent support helps protect brain tissue over time. Doctors studying cognitive aging emphasize inflammation and oxidative stress as key contributors to decline. Supporting antioxidant defenses through natural means helps reduce this risk. Another important benefit is energy conservation. Oxidative stress forces the body to divert energy toward repair. By reducing this stress, more energy is available for daily function, recovery, and immune regulation.
After 60, energy becomes a valuable resource. Strategies that reduce unnecessary energy expenditure help preserve vitality. This spice also supports cellular resilience. Cells exposed to less oxidative stress maintain better structure and signaling. This improves how tissues respond to stress and recover afterward. You may notice that recovery from physical or emotional stress feels easier when oxidative burden is lower. Fatigue does not linger as long. Doctors prefer approaches that reduce oxidative stress gently because aggressive antioxidant supplementation can disrupt natural signaling. This spice works in harmony with the body's own systems, reinforcing rather than overriding them. Consistency again matters. Oxidative stress builds slowly and it resolves slowly. Regular use provides steady support, preventing accumulation rather than trying to reverse damage suddenly. After 60, this preventive approach becomes more effective than reactive strategies. Protecting tissues daily reduces the need for intervention later. By lowering oxidative stress, this spice indirectly supports immune resolution, vascular health, joint comfort, and brain function. These benefits are interconnected. When one system improves, others follow. This is why doctors view oxidative stress reduction as a cornerstone of healthy aging. It protects the body quietly without forcing change.
Regular use of this spice contributes to that protection by reducing the wear and tear caused by chronic inflammation. Over time, this preservation supports mobility, circulation, cognitive clarity, and overall resilience. After 60, maintaining function becomes less about dramatic improvement and more about slowing unnecessary decline. Reducing oxidative stress helps accomplish that, allowing the body to age with greater comfort and stability. Small, consistent daily use is more effective after 60 than large or occasional doses because the immune system responds to patterns, not intensity. As the body ages, it becomes less adaptable to sudden changes and more responsive to steady signals it can recognize and trust. In younger years, the body can handle extremes. Large doses, irregular habits, and rapid changes are absorbed and adjusted to quickly. After 60, this flexibility decreases. Systems still work, but they prefer predictability. When signals arrive consistently, the body integrates them smoothly. When signals arrive sporadically or forcefully, the body may resist or overreact. This is especially true for the immune system. Immune cells learn from repetition. They adjust their behavior based on what they encounter regularly. A small signal delivered daily teaches immune cells how to behave. A large signal delivered occasionally creates confusion. You may notice this in how the body responds to many things after 60. Skipping routines leads to stiffness. Irregular sleep disrupts energy. Inconsistent meals affect digestion. The immune system follows the same logic. When this spice is used in small amounts daily, immune cells receive a steady message that supports balance. Over time, this message becomes part of the immune system's baseline behavior. Inflammation resolves more efficiently because immune cells are trained to complete their cycle properly. Large or occasional doses, on the other hand, act more like interruptions. They may temporarily reduce discomfort, but they do not retrain immune behavior. Once the effect fades, inflammation often returns because the underlying pattern has not changed. Doctors emphasize consistency because it aligns with how biological systems adapt. The immune system does not reset overnight. It shifts gradually in response to repeated input. You may notice that small daily habits feel less dramatic but more reliable. Improvements appear slowly but stay longer. Comfort feels steadier. Energy fluctuates less. These changes reflect true adaptation rather than temporary relief. Another reason consistency matters is tolerance. Large doses may overwhelm the body's processing systems. Digestion, liver metabolism, and cellular signaling all become less efficient with age. Small doses are easier to handle and integrate. This approach also reduces side effects. Gentle daily exposure allows the body to respond without stress. There is no need to push or force results. After 60, the immune system values familiarity. When it recognizes a signal as safe and helpful, it responds calmly. When a signal appears suddenly or in excess, it may trigger defensive reactions. This is why dietary traditions often emphasize daily use of certain spices rather than medicinal dosing, over generations. These patterns taught the body how to integrate them naturally. Doctors who recommend this spice focus on how it fits into meals rather than how much is consumed. Food-based use reinforces consistency and reduces the temptation to overdo it. You may notice that when used regularly, the spice becomes part of your routine. There is no sense of treatment or intervention, it simply supports the body quietly. Consistency also supports other systems. Regular use at meals improves digestion timing. Digestion influences gut health. Gut health influences immune regulation. These systems work best when inputs are predictable. Occasional use cannot create these reinforcing effects. The immune system requires repetition to adjust signaling pathways. Another benefit of small daily use is sustainability. It's easier to maintain long term. Habits that feel natural are more likely to continue.
which is essential for aging well. Doctors prioritize approaches that people can follow comfortably. Long-term consistency matters more than short-term intensity. After 60, the goal shifts from fixing problems quickly to preventing them quietly. Daily habits accomplish this by shaping immune behavior before discomfort escalates. You may find that once this spice is part of your routine, the need for stronger interventions decreases. The body maintains balance more easily on its own. This does not mean larger doses never have a place. It means they are not the foundation. The foundation is repetition. By using this spice in small, consistent amounts, you give the immune system a familiar signal it can rely on. Over time, this guidance reduces inflammatory noise, protects tissues, and supports comfort without strain. After 60, health depends less on what you do occasionally and more on what you do every day. Consistency becomes medicine, and when it comes to guiding inflammation, small daily signals are often the most powerful ones.